Breaking the chains, shocking truths and hopeful advances in hepatitis C. Hepatitis C is a viral infection that primarily affects the liver, causing inflammation and potentially leading to long-term liver damage. This article aims to provide a comprehensive overview of hepatitis C, including its modes of transmission, diagnostic methods, treatment options, and the potential for a cure. Understanding the journey from diagnosis to treatment and the evolving landscape of hepatitis C management is crucial for individuals, healthcare professionals, and communities in combating this infectious disease. Hepatitis C is a viral infection caused by the hepatitis C virus, HCV, which primarily affects the liver. It is estimated that around 71 million people worldwide are chronically infected with hepatitis C. The infection can range in severity from a mild illness lasting a few weeks, acute hepatitis C, to a long-term and potentially life-threatening condition, chronic hepatitis C. Transmission. Hepatitis C is mainly transmitted through contact with infected blood. The most common modes of transmission include sharing needles, syringes, or other drug paraphernalia during intravenous drug use, receiving blood transfusions or organ transplants from infected donors, although this is now rare due to improved screening methods, needle stick injuries in healthcare settings. Less commonly, hepatitis C can be transmitted through sexual contact, from an infected mother to her baby during childbirth, and through sharing personal items such as razors or toothbrushes. Chronic infection. Unlike hepatitis A and B, which often resolve on their own, hepatitis C can persist as a chronic infection in about 75 to 85% of cases. Chronic hepatitis C can lead to serious liver complications, such as cirrhosis, scarring of the liver, liver failure, and hepatocellular carcinoma, primary liver cancer. Clinical manifestations. Many individuals with hepatitis C may not experience symptoms or may have mild nonspecific symptoms during the acute phase. Symptoms can include fatigue, fever, loss of appetite, nausea, abdominal pain, and jaundice, yellowing of the skin and eyes. Chronic hepatitis C may present with nonspecific symptoms or remain asymptomatic until advanced liver disease develops. Diagnosis. Hepatitis C is diagnosed through blood tests that detect the presence of HCV antibodies and HCV RNA. Additional tests, such as liver function tests and imaging studies, may be conducted to assess the severity of liver damage and determine the appropriate treatment approach. Treatment. The primary goal of hepatitis C treatment is achieving a sustained virologic response, SVR, which is defined as undetectable levels of HCV RNA in the blood 6 months after completing treatment. Direct-acting antiviral, DAA, medications are now the standard of care for hepatitis C, offering high cure rates, greater than 95%, and shorter treatment durations compared to previous therapies. Treatment regimens are personalized based on factors such as HCV genotype, liver fibrosis stage, and prior treatment history. Prevention. Preventive measures for hepatitis C include screening individuals at high risk for infection, such as those with a history of injection drug use, recipients of blood transfusions before 1992, and individuals with known exposure to HCV. Implementing harm reduction strategies, such as needle exchange programs and substance abuse treatment programs. Promoting safe injection practices and the use of sterile needles and equipment. Encouraging the use of barrier methods during sexual activity to reduce the risk of transmission. Educating the public about the risks and modes of transmission of hepatitis C. Understanding hepatitis C. A. Modes of transmission. Hepatitis C is primarily transmitted through contact with infected blood. Common routes of transmission include sharing contaminated needles or equipment for drug use, receiving contaminated blood transfusions or organ transplants, and less commonly, through sexual contact and from an infected mother to her baby during childbirth. B. The silent epidemic. Hepatitis C is often referred to as the silent epidemic because many individuals remain unaware of their infection for years or decades since the initial exposure. This delayed diagnosis can lead to progressive liver damage and increased risk of complications. 2. Diagnosis and screening. A. Blood tests. Hepatitis C diagnosis involves blood tests that detect the presence of hepatitis C antibodies and the virus itself, HCV RNA. These tests help confirm infection and determine the viral genotype, which informs treatment decisions. B. Screening recommendations. Regular hepatitis C screening is recommended for individuals at high risk, including those with a history of injection drug use, recipients of blood products before widespread testing, healthcare workers after needle stick injuries, and individuals born between 1945 and 1965. 3. Treatment options. A. Antiviral medications. The advent of direct-acting antiviral, DAA, medications has revolutionized the treatment landscape for hepatitis C. These medications target specific steps in the viral life cycle, leading to high cure rates, greater than 95%, with minimal side effects and shorter treatment durations compared to previous therapies. B. Personalized treatment. Treatment decisions are based on factors such as the genotype of the virus, the presence of liver fibrosis or cirrhosis, previous treatment history, and individual patient characteristics. Treatment regimens are tailored to optimize efficacy and minimize side effects. 4. Achieving a cure. A. Sustained virologic response, SVR. The ultimate goal of hepatitis C treatment is achieving a sustained virologic response, SVR, which indicates that the virus is undetectable in the blood 6 months after completing treatment. SVR is associated with long-term remission and significantly reduces the risk of liver-related complications. B. Public health implications. The availability of highly effective treatment options provides an opportunity for hepatitis C elimination as a public health threat. Efforts are focused on increasing testing, improving access to treatment, and implementing prevention strategies to reduce new infections. V. Beyond treatment. A. Post-treatment monitoring. After achieving SVR, regular follow-up and monitoring are important to assess liver health, detect any potential complications, and provide ongoing support and care. B. Prevention and harm reduction. Education, awareness, and preventive measures play a crucial role in reducing the transmission of hepatitis C. This includes promoting safer injection practices, offering needle exchange programs, and implementing comprehensive harm reduction strategies. 5. The future of hepatitis C. A. Vaccine development. Research continues in the development of a preventive vaccine against hepatitis C, which would provide long-term protection against infection and reduce the global burden of the disease. B. Global elimination efforts. Initiatives such as the World Health Organization's Global Health Sector Strategy on viral hepatitis aim to eliminate hepatitis C as a public health threat by 2030 through increased testing, treatment, and prevention efforts.